Many of our viewers have questions about the coronavirus. We're going to bring in epidemiologist Anne Rimoin and UCLA Dr. Matthew Waxman. They're joining us from our LA bureau. I want to thank you both for being on. It's good to see you. Let's get to a breaking headline from The Hill, which reports that a person in Japan that was reinfected with coronavirus is the issue here, although others think that it could be the results of errors in testing. Matthew, can one get COVID-19 twice?
So, Anne, Alex, I don't think so. First of all, there has been reports initially from China and also from Japan and South Korea that people have tested positive, they recovered, and they tested positive again. I personally think it's a problem with testing. I think right now it's not a big concern.
Okay. Next one, and I've been struck in talking about this earlier about the video of customs lines at Chicago's O'Hare Airport. Look, we are supposed to be social distancing, but as we put this video up here, Anne, this is not social distancing. You've got people packed together for 4 hours, some were saying, even longer to get through customs. What are your thoughts on that?
Absolutely. So Dr. Waxman and I have been talking about this and really thinking about what it can be done here. This is not social distancing. And of course, in any outbreak or epidemic setting, you're going to have situations where people just by nature of how systems work are going to be close together. So airlines, TSA, all of these organizations have to work together to be able to find ways to stretch out lines, keep people as far apart from each other as they can. That could mean distancing flights from each other. You know, Dr. Waxman and I both have worked in Ebola epidemics for many, many years, and other countries have been able to do this in very, very serious circumstances. And I think it's very important for all of us to know there are solutions. It just means everybody, all government, hospitals, public health, businesses need to be working together to be able to flatten this curve. Yeah. Social distancing is key.
Working together and anticipating the issues rather than reacting to them. Let's get to some viewer questions. Here's one from Nancy who asks, I'm a retail worker. Besides cashiering, part of my job is straightening up after people on the sales floor. I wash my hands, use sanitizer, keep my hands away from my face, and stay away from people as much as I can, but I'm constantly touching things that other people have touched. I'm just curious, how long does the coronavirus live on surfaces? Matthew, you get that one.
So literally viruses usually live on surfaces for a matter of hours. There's been some recent data that was done at UCLA saying that coronavirus in the lab may last longer, up to 24, 72 hours. That was in very controlled laboratory conditions. That was not in usual state of affairs in a retail store. So I think if you're using social distancing, if you're using hand sanitizer, washing your hands, following good precautions, you should be okay.
Okay. This next one to you, Anne, and it's from Chris, who asks, how long can the COVID-19 coronavirus stay alive in airborne aerosolized droplets?
So the data that is out there suggests maybe for aerosol a few hours, but we're not really worried about aerosol here. What we're talking about mostly is spread person to person, and that is through droplet. And droplet is only a few seconds as it's going from you to somebody else, maybe even only a second or two. So it's really what we're worried about here is just social distancing, keeping people apart as far as possible. To avoid direct contact. And really where people are getting this virus also is with, you cough or you sneeze, you get it on your hands, you touch something. So people doing the best they can to wash their hands regularly, not touch their face, and if you are sick, stay at home.
So I just want to be clear. So you don't think that the aerosolized version here, that you don't think that by standing next to somebody who may have the coronavirus in just terms of a breathing back and forth, what are your thoughts? Could you get it that way or not?
You know, we're still looking at the data and trying to understand the length of time, and most of these studies have been done in lab-controlled settings, and so it's very, very difficult to be able to extrapolate to a day-to-day situation. But because aerosol is possible, what we want to say to people is you want to minimize going outside. The most likely scenario for being exposed is going to be when you're very close to somebody who's coughing or sneezing. Either they get it on you directly or you touch something that they have touched. So what we really, and should there be any concern about it staying in the air for any small period of time, the best thing to do is not go out unless you have to.
Yeah.
I think that is really the key here. You know, this is a new virus. We're still learning quite a bit about it. And so the best things to do are all the things that everybody keeps talking about. Social distancing. Don't go out unless you have to. And that's a very important issue. You know, I think people are not taking this as seriously as they need to. There are things that we can do to flatten the curve.
Yeah.
Let's all do those things.
That is the goal, certainly flattening that curve. Matthew, I want to give you one question here. It picks up on the issue of a cold. This is from Twitter handle @mypupscmm, who writes that, or CMN rather, my husband has a bad respiratory cold but doesn't have a fever or body aches. Should he be tested only if he has a fever?
So the answer is no. He should be tested if he has shortness of breath. If he's feeling severely ill, he's going to be tested. If you come into my busy emergency department where I'm working tomorrow morning and you have a regular cough, low fever, you're able to walk without shortness of breath, we currently are not able to test you. You should stay at home, do normal self-care, ibuprofen, acetaminophen, which is Tylenol, and keep yourself away from everybody. Stay in your room, drink liquids, do what you would normally do.
You guys sound like a broken record in many ways, but everything that you've said bears repeating. So thank you very much. UCLA Dr. Matthew Waxman and epidemiologist Anne Rimoin. Thank you.